What's up everyone, it's Glenn from My Health Hub. I hope you're all keeping healthy and happy. Unfortunately for us here in Sydney, lockdown has been extended. Case numbers are peaking and that only means restrictions are getting tighter. And it seems like a lot of the case reports are coming from our Western Sydney area. I feel though like the real tragedy in all of this is that the original intention of keeping our community healthy, especially against this virus, has been lost within the mix. And Alex puts it perfectly when he asks, what if we address population health and well-being as aggressively as we managed restrictions? I feel like more focus should be placed upstream. How can we keep our community healthy and safe, especially against something like a viral infection? Now, we know what the current health advice is. Get vaccinated, avoid contact with others, practice good hygiene, and call services like Beyond Blue. But health by definition is holistic. We need to start being proactive with the other components of our lifestyle that can help us to be more healthier and protect us against viral infections. And there's a few ways we can do this, such as watching what we're eating. So good food choices can ensure that we're getting enough vitamins and nutrients for the production and maintenance of our immune cells. The foods that are high in sugar and oil can increase inflammation and hinder our immune function, making us more susceptible to viral infections. So a good way to start is by cutting out the bad stuff and having more of the good stuff. So foods like fruits, veggies, herbal teas, turmeric, these are a form of ionophores, and they help zinc get into the viral cells and inhibit the replication process of the virus. Speak with your doctor to avoid any vitamin deficiencies, to make sure your immune system is as strong and as equipped as possible. So be sure to check out vitamin C. We all know this protects us from the common cold and other viral infections, especially for others who have comorbidities like high blood pressure, high cholesterol, high blood sugar levels. Vitamin D. This study shows that nearly 75% of those hospitalized and 85% of those in ICU care had a vitamin D deficiency. And zinc, which is important for maintaining immune function, and it also inhibits viral replication. Now, Dr. Mark L. Gordon, who is a neuroendocrinologist, talks about another supplement named quercetin, which has powerful antioxidant and anti-inflammatory effects. He advises that the supplementation of quercetin helps carry the zinc ions into the viral cell to once again do its job at inhibiting viral replication. This drastic change in social interaction can unfortunately have a negative effect on our health. In fact, the American Psychological Association have reported that feelings of loneliness can increase stress or intensify the experience of stress. They also found that a lack of social support can reflect depressive symptoms. And unfortunately, this combination of stress and depressive symptoms can inhibit a person's ability to fight off viral infections. One method that's been gaining a lot of traction to counteract the physiological response of stress is deep breathing exercises. This involves taking deep breaths in and out through your nose, using your diaphragm for about 15 to 20 minutes a day, which have been shown to affect your heart rate variability, reduce cortisol levels, and reduce blood pressure. Matthew Walker is a neuroscientist who says that sleep is the best insurance policy that we could ever have. He has found that people who sleep less than 7 hours per night are 3 times more likely to develop a cold as compared to those who average at least 7 hours. He talks about the importance of sleep health to maintain immune health. You can find the link to that video in our bio. Now, you know I'm going to emphasize the importance of being active. We've got 1 hour of outdoor exercise permitted per day. It's a really good chance to get some vitamin D, which is vital for immune health. The sunlight also boosts our serotonin levels, our happy hormones. And regular exercise also reduces systemic inflammatory markers. So this is going to help reduce the amount of load we have on our immune system. So starting this week, at least every second day, for at least 20 to 30 minutes, we're going to go outdoors, and it can literally be anything. It can be walking, skipping, dancing, dribbling a ball up and down your driveway. If you're going to exercise, you might as well make it as fun as possible. Now, We know that the impact of this virus is greater in those who have underlying health conditions, due to the effect that these conditions have on our immune system. So those who are higher in weight, have more fat around their abdominal region, have diabetes, high blood pressure, chronic kidney disease, congestive heart failure. So I hope you've learned at least one or two things from this video, whether it's being aware of the effects that lockdown can have on our health, or some habits that yourself, your family, or your loved ones can start implementing now to make sure you're doing what you can to bulletproof your immune system. Please do not take this as medical advice. Be sure to clarify any questions you have with your doctor. Thank you so much for taking the time to watch this video. From now on, we're going to change the way we view this virus. We're going to make sure our Western Sydney community stays as healthy as possible, and we're going to get out of this lockdown.